Okay, so let's talk about SB 326. So the goal of SB 326 is to modernize the Mental Health Services Act. Um, so originally, like we said, it was to address serious behavioral health needs as well as homelessness. But this new bill expands the funding to include the use to address substance use disorder treatment, which was previously excluded. Another goal is to expand funding to increase the workforce to help. Currently, there's a shortage of behavioral health professionals. So, about 3% of all the funds, the increased funds, are going to go towards recruitment and retention efforts to support the behavioral health industry. Um, Prevention and early identification efforts are another component to SB 326. And the goal is to improve how prevention and early identification funding is spent. So, one example of this would be first episode psychosis programs. We want to see more of those. And then finally, SB 326 wants to bring more oversight and accountability to how all of these funds are managed at the local level, to hopefully, actually make sure the money is being spent the way that it should. And then an accompanying of this is the A531 bill, and it is a $4.68 billion to build new supportive housing and community-based treatment settings. So with that money, they want to build 10,000 new behavioral health beds and housing units. I've worked in mental health for years as a psych tech, and I will tell you, there's not enough beds. There's not enough acute care beds. There's not enough community resources to help all of the people that need help. And so this bill, this $4.68 billion would go towards building 10,000 new behavioral health beds and housing units in the community.